It's over 200 hours and we've been dispatched to a 40-year-old male with back pain. The patient's name is Craig and he's had chronic back pain for the last 3 years. This evening he exacerbated his normal muscular pain lifting heavy boxes from his car. The pain is constant and it's preventing him from getting a decent night's sleep. He describes the pain as achy in the central lumbar area. It's non-radiating. This morning he has pain that's 4 out of 10 when normally it's 2 to 3 out of 10. Sample indicates no allergies, no medical history of concern. He takes paracetamol and ibuprofen to manage his usual pain. His fluid and food intake is normal and there's been no change to his bladder or bowel function, nor is there any dysfunction. My colleague has taken a full set of vitals and they're all within normal range. He's afebrile, he's had no recent illness, trauma or weight loss. There's no rigors, he's well perfused and systemically well. There's also no evidence of IV drug use. I've gained consent from Craig to do a physical exam of his back. Okay, Craig, you're happy with me to carry on with that now?
Yep.
Would you mind just carefully rolling over to your other side? That's it. So I just need to pull your shirt up, Craig, is that okay?
Yes.
So to start with, I'm just inspecting Craig's back for any abnormalities. Looking for scars, rashes, swelling or any bruising. Craig, I'm just going to palpate down your spine. Please tell me if you feel any tenderness anywhere. Anything up here?
No.
Okay. Anything through the mid area?
No.
What about here in your central lumbar area?
Yep.
Okay, so that's the pain that you've
Yeah.
concerned about. Okay, Craig, does that pain go anywhere else? I palpate through here?
No.
What about on the other side?
No.
Okay. Any pain through the rib area?
No.
Okay. Craig, can you just carefully roll over onto your back? Very nice and neat. Craig, have you got any chest pain?
No.
Any pain in your neck or your arm?
No.
Okay. Any pain in your legs?
No.
What about in your groin?
No.
Okay. I'd just like to check your tummy now. Is that okay?
Yeah. Well,
So I'm just going to palpate your tummy. Once again, tell me if this causes pain in your tummy or anywhere else. Okay? So I'm palpating Craig's abdomen. I'm checking for any referral into the lumbar area or into his flank. Considering diagnoses such as a leaking AAA perhaps, cholecystitis, a peptic ulcer or pancreatitis, but he's not complaining of any radiating pain. Craig, have you had any tingling or pins and needles in your legs?
no.
Okay, so can you feel me doing this?
Yes.
How about this?
Yep.
And this?
Yes.
And this?
Yep.
Okay, you press down and pull up. Excellent. Are you able to bend your knees for me? Just go gently. Did that cause any discomfort?
No.
Okay, and can you lift this leg off? Not too high. And down again. And the other one. So I'm just really ruling out any indication of a prolapsed disc at this stage. So everything seems to be okay, Craig.
Yep.
Craig, have you been up and walking since this pain came on?
Just up to the toilet.
Okay. What I need you to do is very carefully sit up and bring your legs to the side. Just go quietly. Okay. So what I'd like you to do, stand without using your hands and just walk a few metres and then come back again. How does that feel?
Yep.
Any pain shooting down your legs or into the groin area?
No.
Okay. Well, Craig, there doesn't seem to be anything sinister going on here, but you're obviously in more pain than usual. When did you take your last lot of pain relief meds?
Probably about 4 or 5 hours ago.
So about 8-9:30 last night,
Yeah.
and it's now over 200 hours, so we're well beyond our 4 hours. Have you had tramadol before?
Yes.
And no problems?
No.
How heavy are you, Craig?
85 kilos.
So what I would give, because of Craig's weight, I would be giving 1.5 grams of paracetamol, that's 3 tablets, 600 milligrams of ibuprofen, which is 3 tablets, and 50 milligrams of tramadol, 1 tablet, which I would drug check with myself and my colleague. Craig, everything seems absolutely fine, as I said, but let's just quickly go through the checklist together to make sure we haven't forgotten anything. So you've had no loss of bladder or bowel control,
No.
you don't have a temperature over 38 degrees, no rigors, there's no abnormal vital signs, you've got no pain in your chest or your upper back, no abdominal pain or tenderness, no pain or loss of sensation in your groin, no loss of power in your legs, you're able to walk, and you've had no generalised illnesses in the last week, 2 weeks, and there's no pain radiating down your legs.
That's right.
Okay, excellent. So I feel it's safe to leave you at home. However, I would like to leave this lower back pain information sheet, and it outlines what you can do in the next sort of 24 hours. Now, you can take your own pain relief again in another 4 hours.
Yep.
It must not be, you mustn't take them before the 4 hours.
Okay.
So you can continue taking those. Now, if you don't get any relief, you might like to consult your GP and have a chat about reviewing your pain meds. There's also a list of things here, what you should do or when you can call, you should call the ambulance again. And please do if you notice any of those symptoms.
Okay.
I would now step aside with my colleague and I would just go through the pause and non-checklist list to ensure that it's safe to leave this patient at home.